Welcome to our new video. Today we are going to discuss about the second video. It is the second video of the biotransformations. In our previous video we already described about the definition, sites, aims and objectives of biotransformation with their phases, phase 1 reaction, phase 2 reaction and the enzymes of that reactions. Today let's start about factor modifying drug biotransformations. There are different factors that modify drug biotransformations. Some are personal factors. Factors related to individual, they are called personal factors. Personal factors includes age, sex, nutritional status and genetic factor. Age. In case of age, in the child and neonate, in younger age, the enzyme system of our body is not so much developed well, so that there is the less biotransformations of a drug. In case of old age, there is also the decrease in the enzymatic activity, because in old age the activity of phase 1 reaction will be decreased, so the biotransformation in old age will be decreased. And sex, let's discuss about sex. Sex in it's the question of anatomy, not a pharmacology. Sex, the primary sexual organ of men and women. The primary sexual organ of men is, remember, it is a testis, not a penis. Primary sexual organ of men is a testis and female is ovary. So the hormone that are secreted from primary organ is known as primary sex hormone. In case of male, testosterone is a primary sexual hormone, and in case of female, estrogen and progesterone are the primary sexual hormone. In case of male, there is testosterone, so testosterone causes the enzyme induction. Enzyme induction will increase biotransformation, whereas in case of female, estrogen and progesterone, that causes the enzyme inhibition, that causes the decrease in biotransformation. Next part is nutritional status. The person who is suffering from protein energy malnutrition or lack of vitamin, minerals and other nutritional factors, that causes the decrease in the biotransformations. And genetic factor, let's take one example, acetyltransferase. Acetyltransferase is one enzymes that causes the acetylation. For example, if we give anti-tubercular drug isoniazid, if there is presence of more acetyltransferase enzymes, more acetylation will occur and metabolism or biotransformation of drug will be more. So, but in case of if the acetyltransferase enzymes is less, then the biotransformation of drug will be decreased. That causes the bioavailability of the isoniazid in the blood will be more. That causes the peripheral neuropathy. Plasma protein binding, the drug which has more plasma protein binding capacity, there is the less biotransformations. Bioavailability of a drug, bioavailability is simply defined as the fraction of amount of the drug that reach in systemic circulation giving to the various route except intravenous and intraarterial route. It is the fraction of unchanged drug reach in the systemic circulation. That means, let's take one example. If we give the drug to a person, if we give a tablet to a person, then it will goes to the stomach. In the stomach, both dissolution and disintegration and dissolution take places and absorption take places. Before reaching to the systemic circulation, it will goes to the liver through the portal vein, portal circulation, and in that portal, when it reaches into the liver, then there is a fast pass metabolism occurs. Then that's called bioavailability of the drug. And decrease in disease state like liver cirrhosis, hepatitis, that causes the decrease in biotransformations, because in case of liver cirrhosis or hepatitis, there is the inflammation in the liver occurs, so there is the less synthesis of the enzymes, that causes if the enzymes are less synthesis, then there will be the less enzymes, the enzymatic transformation doesn't take places. So the disease condition, in disease condition, the biotransformation will be decreased. And tissue binding, there are some drugs which have high affinity towards the tissue. For example, iodine has higher affinity with the thyroid gland, tetracycline has higher affinity with bone and teeth, and digoxin has higher affinity with heart muscles. This drug will take place low biotransformation because they have higher affinity with the tissue and they bind with the tissue. And enzyme induction and enzyme inhibition, this is the important topic of today's discussion. Enzyme induction simply means increase in the drug metabolized enzymes that causes increase in biotransformations. Later I will discuss this briefly in the enzyme induction and enzyme inhibition. Simply enzyme induction causes the increase in biotransformation, while enzyme induction causes the decrease in biotransformation. Other factors includes environmental factors, smoking and alcoholisms. Environmental factor, in case of high altitudes, there is the less microsomal, the synthesis of microsomal enzymes will be decreased, so there will be the decrease in the biotransformations and biotransformation or metabolism of a drug, where in case of urban areas there is the production of more microsomal enzymes and more biotransformations will be occurs. In case of smoking will causes the synthesis or stimulates the microsomal enzyme synthesis, so there will be the more biotransformation occurs in case of smoking. And alcoholism, in case of alcoholism will divides to acute case and chronic case. In case of chronic alcoholism, the biotransformation will occur more, while in case of acute alcoholism, biotransformation will decrease. Let's discuss about enzyme induction and enzyme inhibition in the brief. Enzyme induction is a process by which there is the increase in synthesis of microsomal oxidase and conjugate system due to the repeated administration of certain drugs and causes the metabolism of that drug. Simply, enzyme induction means increase in synthesis of the enzymes which causes the biotransformation. In simple language, there are some criteria of the mechanism of enzyme induction is not till proved, but there is one belief that it occurs due to the transcription and synthesis of more protein, but the actual mechanism is till now didn't prove, but it's believed that due to the transcription occurs, there will be the synthesis of more protein. So the enzyme induction occurs, it is one belief. Now there are some criteria of enzyme induction. The criteria of enzyme induction is, one is it is a chronic process. It is enzyme induction doesn't occur by a single dose. It doesn't induce, this process is doesn't induce by the single dose. It's the minimum time takes for enzyme induction is 4 to 14 days. The enzymes returns to a normal value after the withdrawal of the drug for 1 to 3 weeks. It will after starting of the drugs, it will reach in peak time at the 4 to 14 days, but the enzyme value will comes at normal at after the withdrawal of the drug within 1 to 3 weeks. Enzyme induction causes the biotransformations increase by 2 to 4-fold increase. Let's discuss about the result of enzyme induction. The results of enzyme induction is failure of therapy, development of tolerance, drug toxicity, and there in some cases disease may occur. In the failure of the therapy, when we give the anti-tubercular drug and anti-tubercular drug rifampicin with oral contraceptive pills, then the metabolism of oral contraceptive pills will occur. More metabolism of oral contraceptive pills will occur due to the enzymatic activity that causes the failure in the contraception. This is the example of failure of the therapy. Development of the tolerance. when we give the phenobarbital to a person, then the enzymes will be auto enzymes will be produced. When we give the phenobarbital, auto enzymes will be produced, and the excessive degradation of phenobarbital will be developed. Degradation of phenobarbital occurs and tolerance will develop. Drug toxicity, when in some cases when we give enzyme induction causes the breakdown of the primary drug, that causes the production of the toxic metabolite, that causes the drug toxicity and disease may occurs. In some cases when, like if the person with if in some cases when we give the drug like anti-epileptic drug, then that causes the breakdown of the vitamin D. If there is the deficiency of the vitamin D, then the bone and teeth growth doesn't take place properly. If in these cases, the common clinical features that we found with when we give the anti-epileptic drug are osteomalacia, there is the failure in the bone and teeth take places. And let's discuss about the use of the enzyme induction. There are some use of enzyme induction. There are congenital hemolytic jaundice. In case of congenital hemolytic jaundice, we will use phenobarbital. Phenobarbital causes the production of the enzymes and breakdown of the bilirubin, conversion of and breakdown of the bilirubin, and prevents in congenital hemolytic jaundice we will use phenobarbital. It causes the clearance of bilirubin from our body and prevents from the congenital hemolytic jaundice. And carnivorous, in case of child, carnivorous is a condition characterized by the when the bilirubin crosses the blood-brain barrier is known as carnivorous. To prevent the carnivorous and to treat the congenital hemolytic jaundice, we will use phenobarbital. In Cushing syndrome, we will use phentoin. In the Cushing syndrome, it causes the enhanced or degradation of adrenal steroid. And there is some application in chronic poisoning, because in chronic poisoning there is the enzyme induction causes the synthesis or stimulation of the enzymes and removal or excretion of that toxic substance from our body. And in case of liver disease, we will use this process because this process will helps in synthesis of some enzymes, so it's used in liver disease. Let's discuss about the enzyme inhibition. Enzyme inhibition is a process of inhibition of drug metabolized enzyme. Simply, enzyme inhibition is the process of inhibition of drug metabolizing enzymes. That is particularly cytochrome P50 systems, which includes a number of inhibitors. Example of one enzyme inhibition is cimetidine plus warfarin. Increase in the bioavailability of warfarin, that causes the increase in anticoagulant effect and causes the more tendency of the bleeding, or more bleeding occurs. This is the one example of enzyme inhibitions. There are some criteria, like as enzyme induction, there are some criteria of enzyme inhibition also. Enzyme induction is a acute process, whereas enzyme inhibition is a chronic process. Just the criteria are just opposite to the enzyme induction. It is a acute process, whereas enzyme induction is a chronic process, whereas enzyme induction is a chronic process, whereas enzyme inhibition is a acute process. In enzyme induction, single dose cannot induce the enzyme induction, but in case of enzyme inhibition, single dose can induce this process. This is acute process, single dose can induce this process. It's occur faster with compared to the enzyme inhibition. It is a slow process, whereas it is a fast process. And what are the result of enzyme inhibitions? The result of enzyme inhibition are they reduce the metabolism of the primary drugs and increasing the effectiveness of the primary drug. They causes the decrease in biotransformation of primary drug and increasing the effectiveness of the primary drug. Decrease in the cost of therapy by decrease in the principal drug, because they didn't biotransform the primary drug, so the cost therapy will be decreased. there is the chance of toxic effect because of primary drug, because the primary drug doesn't metabolism occur, so there is the chance of toxic effect of the primary drug. That's all for today. Thank you for watching our video. If you like our video, please like, share, comment and subscribe our channel.